We don't have trouble.
No, I'm just saying that's why we've took
So you've got a commode at the side of your
No, well,
bed?
if we both want them at the same time.
Obviously, at some point, we've got to take these railings out.
Yeah.
On 3.
Right, it's okay there, isn't it? Excellent.
Can we support? 1, 2, 3.
The A&E department at Leeds General Infirmary treats over 100,000 patients a year. With little warning, a quiet day can suddenly become hectic.
Yeah, okay.
Registrar Amjad Mohammed is called away to the resuscitation room. An emergency is on its way.
Is it really heaving out there?
A 9-year-old boy has been knocked over and the team are on full standby. The department's longest-serving consultant, John Sloan, is joining past and present colleagues for the unveiling of a mural celebrating the history of the department. Amjad is still waiting for his emergency to arrive. It's a rare chance for banter with staff nurse Lisa Harrison.
Right, boss.
You're damn right, just remember who's boss.
I don't think it's you.
Can I welcome everybody to the department this afternoon on behalf of the Trust?
There's a lot of humour in the department, which is really nice, you know, atmosphere. It's not silly humour. It doesn't obstruct work, which is important. It's kind of it's nice. It's nice banter and good fun. But we get our work done, hopefully. Now then, Martin.
It's a hit and run.
Oh dear.
Possibly about 50 mile an hour.
Do you know what?
You need to put a cup on your arm. That's going to take your blood pressure.
Oh, I'm sorry, Martin. You're a brave lad.
It's Moira. Moira Grant is responsible for assessing the home life of elderly patients who are brought in for treatment. Today, Moira has to deal with Marion. Her husband Bernard woke up to find her with blood around her mouth. Marion needs convincing to stay for further tests.
Well, I'm 90, but I don't think I've been married too long. I'm quite, you know, and I was 20, about 20 when I got married.
You were more.
You are?
You were more than 20.
I wasn't much more. No, but about 4 marriages before that, you know, just to get tuned up, you see.
Not lying.
Yeah.
It's lying.
Dr. Hamer tells me that you're known to one of our geriatricians. I bet you can't remember the name.
Yeah?
Doesn't hurt. Look up. Right up.
Okay. What's this horrible man doing to you, eh?
Can we just put something on that for
Not yet, Martin. You got some lucky hands there, haven't you?
Martin, we need to pop a needle into your other arm, OK, so it's going to hurt for a second.
Oh, well done.
Dawn Abbas is a senior sister in the department of 10 years standing. She makes time to attend the unveiling before the start of her shift.
The occasion is the opening of the Jubilee mural, which is just down the corridor there, and that's got various photographs of either people or different images, you know, x-rays of things, just really how accident and emergency has progressed over the years.
Emergency department open.
It's really interesting seeing some of the photographs from years ago of some people. Mine's quite recent, mine's about 5 years ago, but some are very, very old, so it's really good seeing them.
Is that so?
It's so down here over there.
What about when I press really hard?
Amjad's sure that Martin's right leg is badly broken, but the swollen tummy worries him. It may be the result of serious internal injuries.
Yeah, let's clean him up a little bit. We'll do that in a second. I think he's got a fractured femur on that side, so he needs that sorting out. We're going to have to give him some local pain relief there, nerve blocks going into that area. Just to make it nice and numb for him, really. Hopefully we can then move him around a little bit. All right, you're a good lad.
Keep very, very still, Martin. Very, very still.
Moira's found Marion's past medical records.
Is it a house that you live in or a flat?
It's a house.
It's a house. Is that your own house?
Yes, yes.
Okay, and has it got stairs?
It's a house I was born in 90 years ago.
Was it really?
Yeah, so when I bought it, I had to pay 3 and 6 a week to Building Society.
Can you remember your phone number?
No, I just go to the phone and ring.
You never ring yourself, do you? I know.
A quick change and Sister Dawn Abbess begins an 8-hour shift. She's one of the senior nurses who can now diagnose and treat minor injuries.
What did you do it on?
Peter's cut his finger gardening.
I was coming down in the arc, I happened to hit the wall and it bounced off onto my finger that I was holding the plants back with and just sliced that top off. I was very lucky, I could have lost my finger.
You know, it'll heal and it'll be okay. They said you'll need to leave them on for 5 days. Okay. Then after that, you take the dressing off.
Will it heal by then?
Well, hopefully. It should be well on its way for healing.
And what about the loo? Is it a downstairs toilet?
We have a commode.
Oh, yes.
You've got a commode.
Oh, aye.
And have you ever fallen over trying to get onto it?
Oh, with 2.
You've got 2 commodes?
With 2 commodes, 1 spare, you see. We don't want to fall out of the commode.
We don't have trouble.
No, I'm just saying that's why we've 2
So you've got a commode at the side of your
No, well,
bed?
if we both want them at the same time, we don't want to be arguing.
You don't, you're right.
With Martin's neck and spine x-rayed, the team can now put a splint on the broken leg and somehow ease the discomfort.
Analgesic, strong analgesic, just to ease the pain a little bit, just generally. And then we're going to put what we call nerve block into his leg to actually numb the whole leg.
Okay, now. So you try and get on this side, right?
Okay.
So that you can pull up the artery. Yep. So it's a vein artery nerve. Down with the pubic
Your leg's going to go away.
Okay. Yep. So then you can go a bit deeper down. Oops.
Sharp scratch, Martin. Nearly done. Good boy. Well done.
Please, somebody come and help me and see what they can do.
Dawn tends to Hannah, who's been mugged while out shopping. Physically, there seems to be nothing wrong, but she's shaken by the experience.
You know to say what were you doing and what this and that, and it's all my fault if anything. I mean, they stole my purse.
Would you like a drink?
No, I've had some tea, love. I've had 2 cups of tea. The people who took me over ever so kind.
You were really kind.
Martin, your mum's coming in to see you. Martin, your mum's here. Look how we've got here. Over there. Come on.
There you go. Can I just ask you about his tummy? Is it tummy normally like this? Is it? What do you feel is different?
No, it's not.
Amjit's worries over Martin's stomach are confirmed by his mother. He calls to request an immediate scan of Martin's internal organs.
However, his mum's noticed and we've noticed that his tummy's being distended, although he's not complaining of abdominal pain.
I can't get over this. It's not fair. I've had anybody in my life. I have, honestly.
The scanner is a short distance from the resuscitation room where Martin was treated. It will quickly identify any internal injuries.
Martin, I'm going to get some special pictures of your tummy for us, alright? All you need you to do is lie still.
Another child arrives in need of emergency treatment. 14-year-old Heather slipped off a wall and landed on railings.
Right, we're just going to have to stick it nice and steady, Heather, just get in.
Right, there's a little ramp.
There's a little coming up, just really slow.
Registrar Steve Bush prepares the trauma bay, whilst consultant Wayne Hamer takes the handover from the doctor at the scene.
Just some atropine to dry up the secretions. Really a good idea.
The fire brigade have cut round the section of the railings on which Heather fell. One of the spikes is embedded under her chin.
We've got the anaesthetist down here because, of course, in that sort of situation, you're worried about the airway. A, B, C, and A is first. But also, there's the rest of it. You can bleed quite a lot from these injuries, and you need to make sure that the whole person, rather than just the airway, is okay. So there'll be quite a few people around this patient.
I'd like to see him again. Herbie, come into this big room now, just where we can get you a set. What's the matter? You want your rub? Yeah, you rub, you don't worry about that.
The scan is a sophisticated X-ray which gives slices and cross-sections of the body. It's able to look at soft tissue and gives a clear picture of Martin's internal organs. The scan gave the all clear. Martin's broken leg was the worst of his injuries, and after 3 weeks on a children's ward, he's back at home.
Just relax and we'll sort you out. Okay, right, well, there's absolutely no airway. She's talking well, you know, so I just wonder whether we can sort of start to undo some of this lot.
Yeah, we can.
Yeah, sure. Yeah, no, sure. It's just when we think about transferring.
We'll give us some ketamine and then we're going to lift her across, okay?
I managed to plug her teeth because I was just actually
Right, so Heather, what we're going to do is we're just getting some medicine that we're going to give you into one of these things in the vein, okay? You know, these needles you've had put in. They're not very nice at the time, but they help us later on. We're going to give you something to make you feel a bit sleepy, and then you're going to have a feeling of movement because we're going to get you across onto another trolley. Obviously, at some point, we've got to take these railings out at the time.
When I'm asleep.
In a head-on collision at 30 miles per hour, your body weight is multiplied by up to 25 times, which is why every new Citroën Zara comes with ABS to stop you short of trouble, and 4 airbags should the unexpected happen. The Citroën Zara, now from £10,495. Confidence comes as standard.
You see many people who is making like this and all time making like this. It's not fitting on their face. So we create a custom light. You need to have 6 measurements. 1, 2, 3, 4, 5, 6. It's like wearing nothing. I don't know why, but nobody, it's amazing. Nobody else does it. Only Vision Express.
One reason people live longer in the Mediterranean is their diet. Fresh fish, vegetables and olive oil help keep them healthy. So sometimes they visit the doctor for other reasons. Olivio, made with the oil of age-old olive groves.
Yeah, I've just had it resprayed. Raging Bull Red with super sheen metallic finish. Nice, isn't it? The dysentery beige wasn't exactly a babe magnet. Anyway, I had to save a few bob to get it done, so I sort of forgot to pay my TV licence. And I got caught and fined. Still, the lasses don't notice in the dark. Or if I stand here, like this.
A dirty bottom can cause irritation and redness. Kiss it better with a Johnson's Baby Skincare Wipe. Our wipes have a special Johnson's Baby Lotion that helps protect from irritation, leaving him with a perfectly clean, healthy, lovely little bottom.
Is that Mullenite yogurt?
Yeah, it's great.
You're not a believer then? What? In the pleasure pain theory? That's right.
30, love.
Nah. I mean, just because I'm enjoying all this pleasure doesn't mean someone else is getting the pain. Yeah.
40, love.
As if.
New balls, please.
So much pleasure. Where's the pain?
How do you make the most of your computer?
I do all my banking online.
With Barclays, you get free internet access for life.
The drug we've given her, a drug called ketamine,
Even though she's talking like, it's very unlikely she can remember it.
Consultant Wayne Hamer explains Heather's condition to her mum and sister.
But what we've given her now, she's very unlikely to remember this from now on in. Okay? So that helps a lot, doesn't it? We're almost going to put her to sleep now, really. So,
Staff nurse Lisa Harrison reassures Heather and tells her what's going on.
What we're going to do is we're going to lift you on the board underneath. Okay.
Okay, guys.
You probably won't remember us doing it, but this ketamine that you're having is just that'll make you feel sleepy.
She's slipped and fallen onto mine railings. And it's quite a major injury, this.
Just let me get a clear picture. You drive to the supermarket
Yeah.
and you walk round the
Oh,
supermarket.
yes. All right.
yeah, on 3. 1, 2, 3. That's good. Great. Okay, guys, can we all step back now then? Can we do a room? Let's have a mark on the ground here. And what about the weight of this thing now then? Can we just, right, it's okay there, isn't it? Excellent. Okay. We're just going to X-ray your neck now,
I do appreciate it.
All right, it doesn't hurt at all. Is there some reason for that? Okay. No, okay. Can we just keep it on gently for you? Just gently, that's all.
Lovely Alice, 19, can go back to the home, but she needs comfort. She's had nothing since lunchtime.
Consultant John Sloan sees the first patient of his shift.
Can I come and let's have a little chat?
Patrick's been complaining of chest pains.
Well, I had one this morning when I was playing with baby.
And the pain lasted seconds, minutes, or...?
Well, a couple of minutes, but time I'd got up and sort of sorted myself out, I was okay.
So tonight it felt like this tight pain again?
Yeah.
Right.
I don't feel too bad now, I just feel a bit warm, actually.
Do you take tablets at all?
No.
Do you smoke?
Yeah, I do.
How much do you smoke?
About 40 a day.
Moira needs to find out how well Marion can move around.
You can't take trolley.
I know I can't.
Is that heavy again? Let's just lift it off you a little bit there. Okay, well done.
Wayne calls for the standby surgeon, Mike Corrigan, to attend. Between them, they'll decide how to remove the spike.
It's a single penetrating wound now, really. And it's just the weight of the whole thing, really. You can see where the level of it really might have gone into.
Okay. That'll probably be just short of
Antrim.
Or into hard palate. Yeah. We need to get her up to
We're going to be sick. Yes, yeah. What a sucker.
Do you feel sick at all?
I was sick this morning, but I don't know if that's got any connection with
You were sick, were you?
Yeah, this morning when I first got up.
Right.
But as I said, I don't feel too bad now, I just feel a bit drained. I just feel tired.
I'll be your stick.
Marion seems more willing to accept help than first thought.
Okay, after 3.
Don't forget I sat all day.
Oh, well, that's why we're here giving you a hand.
It's a long time since Butlins holiday roller skating when you worked at Butlins, isn't it?
Ooh.
Roller skating.
Hey, this is why you like this now then, isn't it?
Aye.
I have skates at home, but I can't get them on.
Well done.
Don't worry. I've never given in yet.
Would you mind sitting forward for me? Breathe in and out for me.
Throat's a bit dry.
There's the girl on your back.
Aye, it's been a long time with that.
The spike is dangerously close to Heather's jugular artery, but Mike and Wayne think it needs to be removed now.
But we think that it's just so traumatic to wheel her around in the discomfort. We're going to virtually give her an anaesthetic here and take it out, really. He wants to consider giving it a young kid.
Right, okay.
What do you think?
I mean, all I can do is give her some more ketamine and go for it with that.
Should we ketamise that?
Yeah. I'll just let theatres know what we're up to and go for
Well,
that.
keep him on standby, eh?
Yeah, because if it bleeds,
Mike?
we'll have to go, won't we?
I think we probably would be happy with that. We can give her more ketamine and just, rather than infiltrate with local, we can ketamise her to a, so she's completely dissociative, really, and then pull it up if you like. Do you want any surgical packs available or anything?
Yeah, I think we would do just so we can pack it.
Okay.
But then we'll have to get her up to a theatre and we want to explore it.
Okay.
But it's going, the actual movement of taking her up.
Yeah, it's more, okay. Right, we're going to take that again. Yeah. Oh, right. Is it working? It's working.
Big pair of scissors. Exactly. I'm not going to get through this, sorry about that.
You would think about staying in hospital for a day or two?
No, honestly I wouldn't. I have a big fat pussy.
You've got a cat at home?
Oh, beauty.
Right.
I can't say for sure whether it's your heart or not.
Right.
And the fact that your heart tracing's normal doesn't mean it isn't your heart. Now, don't be over anxious because my gut feeling is this is probably going to be one of those things, but I can't tell you for sure, okay? So you need to stay with us, and if it is, then you're in the right place and we can do the right things for you. You understand that?
Yeah. Okay.
Yeah, can we move?
Okay. Right. Okay, we look like we're ready. So, 4 men, 1 on each corner.
Okay, I'll be the...
Nice big breaths in and out on there for me, sweetheart. Nice big breaths. Nice big breaths. She's fine.
Okay, ready to go?
Yeah.
Ready?
Take the weight.
Okay, take the weight.
Yeah.
Round that way. Well done.
Okay, let's get that out of the way.
The spike is removed, and Heather must go to theatre so the wound can be explored and treated.
Sure.
You going to put it on?
It could be his heart that's behind it. I mean, I'm soft-pedaling with him slightly to reassure him that if there is a significant risk, it could be his heart that's causing it.
I've read things about smoking and stuff like that. I smoke. I work nights, and I'll go through with a night and day about 40, 45, maybe 50 cigs a day.
Smoking is one of the worst things you can do in terms of your heart arteries, your coronary arteries. So it's a serious risk factor for him to be smoking that much. So, I don't know. He needs to stop. Maybe this will be the thing to stop him smoking.
Fortunately, Patrick hadn't had a heart attack, but stress-related panic attacks.
She's called Marion Lee. Yeah. How can you refuse to have them back?
Moira and Wayne are trying to find Marion a bed.
Hi.
Oh, that's marvellous. It's been in lately, 3 or 4 times lately. Marvellous place.
Well, I just can't see how you can refuse to take a patient. You know, we're short of beds, and we've got a patient that needs assessment on a geriatric ward. You know, I'd feel very unhappy if you start saying you can't take patients. I mean, you know, listen, what happens if I come into work and say I don't want to see patients today, or I don't want to take somebody? I'd like to speak to him, asking why, really, because then I'd have to speak to the medical director and say, you know, you better speak to this guy who doesn't want to take acute patients anymore.
Apparently the consultant said he will have this lady back under his care.
No, I understand. No, and I certainly don't want you to, you know, I certainly don't want you to feel intimidated or get a.
There's always more than one side to every story, though, and apparently when she was on the ward, she was an absolute devil up there, and he said it's not appropriate for her to go back up.
Thanks very much. Bye. As soon as she gave me a pen, she said transfer her up. So there you go.
So we're going to Ward 9.
Yeah.
That's what we need consultants for, isn't it?
She's comfortable now. She's had some painkillers. We're keeping her asleep with some medicine, and we'll wake her up at the end of the operation. There's no problems there. She'll be much more comfortable without that.
Do you have any idea how long it'll take?
Heather made a full recovery and is back at home with her family.
But there's been no great bleeding. Her trachea and everything is all fine, so hopefully.
Thanks.
It's the end of Dawn's shift. She hands over to Sister Mary Nelson.
She claims that her partner forced her to take 12 tablets of what we don't know. And then he now says he's taking an overdose.
Oh, God. Suicide pact.
So...
They're interrupted by an emergency call from ambulance control.
Amy, Sister or Joanne?
Thank you, are you going home?
A 21-year-old man has fallen 13 steps.
So it's going to be very important that you take the pills that they give you.
Right.
I wish I could believe you were going to do it.
I will when I get back.
You're going to hospital now?
No.
Did you fall at home, do you know?
13 steps or 13 steps?
13 steps are different if they've got carpet on them.
Yeah, true, yeah. Not as many as 39 steps, though.
No, that's right.
You ready? Oh, you've not need to go. It's right.
A GCS of 3.
James fell down the stairs at home. Amjit's worried about his coma-like state.
He's been drinking all day.
Okay.
Can we get a scoop out?
Yeah, we'll do.
It could be excessive drink, but Amjit has to get all the facts.
He's not taking any drugs or anything, we know. No.
Moira convinced Marion to have further tests in a nearby hospital. After a 3-week stay, Marion returned home to be with Bernard and her cat. Initial concerns that drugs may be the cause are quickly ruled out, but Amjit's worried that the lack of response from James indicates a life-threatening injury. The reason for James's collapse was never clear, but after 2 weeks in intensive care, he's now at home recovering.
James! James! Open your eyes for me.
And there's more from the Sharp End at Leeds General next Tuesday night at the same time, 8 o'clock.
For a free copy of the fact sheet that goes with this series, write to AME PO Box 55 London W128UE.